Good afternoon. My name is I am our healthcare technical lead at AWS, focusing on our partner network. And really pleased to be here today to really discuss and learn more about how you can maintain compliance for virtual care platforms in the AWS cloud. And we're going to be joined today by Synzi and by ClearData as they sort of walk through their journey together. And I'm really pleased to be joined by Matt Ferrari and Mark Knudsen as we sort of explore their journey and understand how Synzi has built on top of the ClearData platform and leveraging the compliance expertise that ClearData provides to drive their business outcomes. And we'll really dive in and understand sort of why a virtual care platform moved to the cloud, the benefits realized, how we worked together with ClearData as well to really drive that meaningful outcomes and ensure that Synzi's solution remains secure, remains compliant, and aligns to the needs and protects patient data. And to dive in a little bit to the speakers who you hear from today, really pleased to be joined by Matt, who's the co-founder and CTO of ClearData. He really focuses on ClearData's overall product and technical strategy, and is someone that I've been working with for several years now. And Mark is the Chief Experience Officer at Synzi, really charging and managing the overall client interaction and performance of Synzi's technology and platform and solutions as they look to really solve that challenge of how do we communicate with patients in a way that positively affects them and empowers them around things like reducing readmission risk, increasing adherence, and overall increasing satisfaction for not just the patients, but then the staff that are working with the patients. And what we'll talk about today is we'll focus on the importance of security and compliance in healthcare. Why we're sort of moving beyond this idea of healthcare in the four walls of the hospital to really thinking about the patient interest in receiving care at home. We'll talk the benefits that Synzi has realized of working with ClearData and building on top of AWS. We'll talk about the innovative ways or the ways that Synzi is innovating to deliver home care with technology. And in addition to talking about the importance of security and compliance in healthcare, we'll talk about general tips to reduce the overall risk posture of your organization. At this point, it off to my colleague, Matt Ferrari, to talk a little bit more, broadly about ClearData and the security and compliance challenges that healthcare organizations face.
Great. Thank you, Aaron, and really grateful to be here today to talk through some of the challenges that are out there in the market. Before we, dive in, and I really want to get to the Synzi conversation as quickly as possible, I at least wanted to provide some notes around what is actually going on in the security and compliance that's critical. And look, I think everybody knows the safety of the patient is really paramount, right? As the industry, we know that we've done a suboptimal job in protecting patients. If you think about some of the studies out there, we know that, the 6th annual benchmark study on privacy and security for healthcare data found that many healthcare organizations and their business associates are actually negligent in terms of handling patient information. When we refer to business associates handling patient information, don't just think about the actual storage of PHI, but instead the processing, the transmitting as well. And so all of that comes into account. And we know, look, the results have cost an estimated $6.2 billion or about $2.2 million on average per data breach. And we also know that more than half of the organizations in the study were unsure or unaware of how patients or customers were actually affected. Matter of fact, oftentimes my own family will ask me, what really matters here? Okay, my patient record was taken. How does this actually affect the industry, and the person. And so we're going to talk a little bit about that today. And then finally, the study kind of went on to say that approximately 2/3 of the respondents don't offer any protection services for any kind of breach or breach some kind of insurance for the victims, and the majority don't even have a process in place for correcting errors in victims and records. So what do we really do about that? And so that's kind of where I want to dive in today. If we think about some of the actual outcomes here, you can see that people are actually getting hurt out there, right? They're getting billed for services they didn't receive, and many of you probably have experienced that. I certainly have. You have misdiagnoses because you're starting to see patients that have been modified by others and compromises and falsification. You see that allergies have actually been altered in the industry, and then finally, you see lots of legal trouble around individuals that are leveraging other patient records and protected health information for some kind of distribution. And so lots of fraud out there in the market. As we think about some of the stats out there, 93% of healthcare organizations have experienced a data breach since 2016, and 57% have had more than 5 data breaches during that same time frame. I think that that's pretty important because a recent article in Healthcare Finance actually tells us that healthcare data breaches in 2019 cost the industry $4 billion, and certainly we're not trending in the right direction. We know that healthcare providers are oftentimes the most targeted for cybersecurity incidents or legal declarations of breaches, with nearly 4 out of 5 breaches per the report occurring in the provider space. And look, I have constant concern that we're not paying enough attention to the severity of the problem, and we're under attack. And I'll let you kind of read through some of the stats in the ongoing slides that hopefully organizations can start to take action to change the way that the market trends are looking. If you look at some of the records stolen, you see a big number here, right? 1 in 10 of us have actually had our medical identity compromised. And because of data sprawl in healthcare, it's a misnomer to think that your data is just living inside of one database or one electronic medical record. It's not like calling your bank when your credit card gets stolen and all of a sudden you've turned everything off and have everything reissued. You're going to get bills for surgeries you never had that are going to take a tremendous amount of time to get corrected. But even more threatening, your record could actually be changed. Your prescriptions, your allergies, your diagnoses could be altered by thieves, that are out there looking to get opioids, pay for surgeries that are on your dime. I will tell you that I have 3 little ones, and 2 of them have had their own patient records stolen. And of the 2, one of them actually had a knee surgery that never occurred because he's never had any kind of problem with the knee. And so one day, I got bills myself, for a minor that never had that kind of surgery before and could have, a damaging impact not only on his record moving forward and credit report and all those things. And you think about the poor nurses and doctors that out there that potentially did some kind of fraudulent act without knowing it, while they could have been taking care of another patient that actually was in dire need of help. And so you see that as a growing problem in the industry, and many people out there don't quite understand that. If you think about the hospital perspective, 90% of hospital representatives surveyed in the Black Book survey back in November said that their IT security budgets have remained flat, right? They remain level since 2016. You often hear stats around gross margins or profit margins in the provider or healthcare hospital space to be razor thin, percentage points, if that. And with an IT perspective where there are aging systems with a lack of security, a lack of compliance, a lack of automation, and the ability to take advantage of all the amazing technologies out there, both from healthcare IT organizations, but also public cloud organizations like AWS, it's really, really tough for a healthcare hospital to leverage and modernize their IT security when they probably don't have the legacy when combined with a flat budget. So that is one of the key things that is out there as a challenge. And then I would tell you from kind of a physician perspective, physician organizations out there are reporting a decrease in cybersecurity expense allocated, and some of them have less than 1% of their IT budget earmarked for cybersecurity. I don't want to sound too Debbie Downer here. There's many organizations that I get to talk to that are upwards of 15% or even 18%. But the truth is, it is no matter the figure that we're going to believe today, it is a appalling amount of activity from a cybersecurity risk perspective versus the actual spend inside of the healthcare organization. And so what you'll see from the study is that physician organizations and groups actually report a decrease in this expense. And when you factor in that estimated cost of a legal declaration of breach from hospital organizations that are responding to the survey, it's about $423 a record. So clearly it's time to address the spending issue and to take a look outside in from a security and compliance perspective on how can this problem be solved when there's not additional monies out there to actually solve it with. So as you can see here, some hospital organizations are actually shoring up their resources by bringing in security solutions, and third-party organizations see that 70% of IT management respondents actually say that we're not fully aware of the solutions that exist, right? So you've probably heard things like the unknown unknowns in the market, right? The CIO doesn't know what he doesn't know about their current network, their current state of vulnerabilities, and potentially some of the solutions that are out there in the marketplace that are actually solving them. So super fortunate in my role to be able to focus on how do we educate a lot of these hospitals on what solutions are actually out there. And sadly, I wanted to kind of point out here that 58% of hospitals don't actually select their current security vendor until an actual incident, right? So they don't say, I need a intrusion detection service, or I need a vulnerability scanning system, a malware service, until something actually happens, right? So you think about you're waiting until your house is robbed to see if the locks actually work. And so more than half of the hospitals out there. And so that's a pretty stressful thing to be issuing an RFP or request for proposals after the fact that you've already had some kind of security incident. So there's a lot you can do to get in front of this stuff. And so, I wanted to dive into some of the ways down the line that from an RFP perspective, you can actually try to address this up front. And then I would tell you from a challenge around healthcare organizations that aren't actually doing scans. One of the things that I see in the industry is that when healthcare organizations are running their own infrastructure or running their own applications, either in the hospital or let's say in some kind of private cloud, oftentimes they aren't doing consistent scans of their actual environment for vulnerabilities. And you may think, okay, that is security patching, that is application patching, but oftentimes it's a bigger problem. Oftentimes it's at the code level, and many hospitals don't have developers. And so they're buying third-party EMRs and population health and revenue cycle and other applications out there, or maybe legacy systems in the tax space as an example, and they're not doing ongoing scans for code vulnerabilities. And so you see here that that's a massive issue that is going on inside of the healthcare organization. And then finally, the kind of the real soul crusher of all this is, those who have put a freeze on their credit. And you can see that they're doing things around credit monitoring. And if you've been through a security breach like the one I mentioned with my own children, you know that oftentimes you're offered some kind of credit monitoring and a check-in monthly to see if your records, your credits, your taxes have been compromised. And then you're the one who has to comb through the medical record every single time that you need to make sure that it's still accurate. But what you can see here is that 94% of those hospitals have not actually augmented their cybersecurity protection since their last breach. As a matter of fact, a lot of the time that and our Chief Privacy and Security Officer spend out there is educating these hospitals and healthcare organizations on specifically what cybersecurity insurance is and how to actually respond almost tabletop style to some kind of security event. And look, we know that as an industry, we've got to raise this bar, right? We've got to actually do better because we wouldn't accept this kind of failure from, hopefully any other industry out there. And, if you think about moving from one hospital to another, there's a lot of better care models out there that are really trying to address this issue. But be advised that you have a right out there to really ask around the cybersecurity procedures as the patient. I wanted to hand off to Synzi here because it's just an amazing story here. But I will tell you that Synzi's been taking protecting patients and data to heart for a very long time. And I would tell you that since their inception and even over the last year, as I've got to know Mark and the team, they really turned their attention to the home health market and, kind of brought a deeper security mindset with them. But, before we get too deep into that, Mark, would you mind kind of unpacking things out there that are driving this trend in care models?
Absolutely. Thanks, Matt. So, yes, let's talk a little bit about things from the average, everyday individual who's out there, living their life, navigating health issues, and sort of how they're thinking about things. Because we need the solutions, as Matt has gone through so clearly, we need the solutions to be supporting these patients and not compromising certainly their data, but also compromising their life because now they've got additional stressors that they have to navigate. So from the beginning, Synzi has been focused on trying to deliver care to individuals in their home, in their residence. And if we just kind of look at how trends are moving for healthcare and for individuals, one of the things that you'll hear quite frequently is the concept of aging in place. And the CDC has defined that as essentially an individual being able to live out their life regardless of circumstances in their home. And if you look at our aging population, 87% of senior adults would like to age in place. They'd like to continue to live out the remainder of their life in their home, in comfortable circumstances, with all sorts of practical and emotional ties that go with that. But if we also look at that aging population, they've got challenges. I think we all know that. There's headlines all the time. A couple of statistics on this slide is 80% of older adults have at least one chronic condition that they're living with. And 77% of Medicare beneficiaries have multiple comorbidities or chronic conditions that they're navigating. So you've got this sort of tension between individuals who want to be at home, don't want to be in a healthcare facility to navigate this. So the question is, how can you effectively deliver that care and deliver it in a way that's going to make a difference for the individuals, but obviously we have to deliver it securely in a way that's enhancing the life and comfort of these individuals, not adding further stresses. So there's this concept that's actually been out there now for a couple of decades, started out of a professor from Johns Hopkins. He and his colleagues initiated this idea of the hospital at home. And they did some initial testing and studies to really prove out that even for more acute, higher risk issues, that care can be effectively delivered at home. And the outcomes from a health perspective as well as a satisfaction perspective are actually very high. And I think it's an encouraging benchmark as we look at shifting trends in terms of how care is delivered, how individuals want their care delivered, and can we actually achieve this aging in place? And I think the answer is yes. But there's a lot that has to take place. There has to be an effective communication back and forth between that patient and their care team in order for the in-home experience to be beneficial and realize its potential. And so that's part of the problem that Synzi's trying to solve is if you're going from a facility and that individual is going back into their residence, how do you engage them in those first 24 to 48 hours that are critical for ensuring that that care plan and the outcomes of whatever procedure was happening in the hospital is going to stick, that that patient is going to get traction and make progress at home, and really start to realize that reality of getting better, aging in place, and seeing the outcomes that really everybody will benefit from, the individual, the payer, the provider, etc. So virtual care is a phrase that you'll see in a lot of articles, a lot of headlines. It's gotten a lot of traction. It has some overlap with the old terms of telehealth and telemedicine. But really what it means is how does technology get leveraged as an effective conduit for communication between the patient's caregivers, and the various clinicians that are delivering care for that patient. And so Synzi looks at a variety of channels or modalities for delivering this virtual care. There is this concept of a virtual visit, which for all practical purposes looks the same as a conversation or video chat that you might have on FaceTime or WhatsApp with friends and family who are distant. Obviously, as we've already started this conversation, it can't be on FaceTime or it can't be on WhatsApp because we need to have protocols and compliance to ensure that all of this data is encrypted, that it's secure, that it's safe, that it's not have any risk of compromise. So as Synzi looks at virtual care, whether it's a virtual check-in, whether it's communications that go out through other channels such as email or text, that we're making sure that PHI is protected, that PHI is never put out into a public channel such as email or text, and that when PHI needs to be discussed, it's in a secure environment, such as secure messaging, which is outside of the typical communication channels. So aging in place, delivering virtual care, it requires a lot of intentionality. And unfortunately, in our client base, there's been sometimes in the past maybe a use of convenience over security. And so there's maybe a nurse that wants to communicate with a patient and ends up sending out PHI over a public texting channel. So that's obviously not best for lots of reasons. There's personal liability as well as corporate liability. There can be very significant fines that go with it. And as Matt talked about earlier, we're not doing our patients any service if we're compromising their data, their PHI, in the process of delivering care. So we have to find the balance. We have to find the solution of delivering efficiency and convenience, but doing it in a way that is secure and safe and data is protected. So from a Synzi perspective, and we'll talk a little bit about sort of our AWS and ClearData journey in just a minute, but we've looked at it from the beginning of we want to deliver a solution that the patient values, that provides independence in the home for them, lets them talk to their care team. So it's not a series of splintered, fragmented conversations, but it's actually an integrated conversation. That benefits the care team as well because they've also struggled with fragmented conversations. So if we can get everybody into a secure communication cadence that lets clinicians speak with clinicians, speak with patients, speak with their caregivers, now we've got a holistic conversation that really starts to deliver the outcomes that enable aging in place. It also allows for various modes of communication so that it's not mass mailings that to date are generally considered secure because you've got a sealed envelope. So certainly there's a lot of PHI that gets delivered that way. There's been historically PHI delivered through IVR channels because there's some level of ability to verify and know that you're reaching somebody on a given phone number, but it's fragmented, it's not preferred channels, and it tends to be sort of mass communication. So we've been looking at how do you personalize, how do you allow one-on-one conversations that each individual patient gets the care that they need. And you need to be able to make that accessible. So one of the key things for us from the beginning has been, how do you deliver these communications on consumer devices? Again, has to be delivered securely, has to be delivered safely, but it needs to be delivered in a mode or a manner that every individual can take advantage of. So that's been core, and that informed sort of that vision of product and how we wanted to deliver virtual care. Informed our very beginning. So Synzi was founded in January of 2018, so we're just 2 years old at this point. But from the very beginning, conceptually, we knew that we wanted to have a product that was delivering communications to consumer devices, which meant we needed to be in the cloud. It also meant that we needed to have all of our sort of ducks in a row, to use the metaphor, from the very get-go, so that we knew that there wasn't any opportunity for unsecure, unencrypted data, for data breaches, what have you. So we knew right at the beginning that we wanted to work with AWS and that we wanted to work with ClearData. We wanted to ensure that the infrastructure that is delivering the services and the communications, that's securing the individual patient data and their PHI, was robust from the beginning, that there were supporting monitoring services to basically make sure operationally that there wasn't any chance for a breach, and that we would have ongoing reporting and compliance insights so that we knew from day one, but going into, now beginning of year 3 for us, that for all of the different moving pieces and parts of our business, we're not concerned that we're going to be one of those negative statistics that we went through earlier. And I think the combined partnership of AWS, how they provision and enable performance and delivery and security within their own infrastructure and services, and then ClearData supporting solutions and services to us, we are able, through ClearData, to deliver all of our product and services in a HITRUST certified environment, and that's critical to our clients, it's critical to their patients, and it's critical to us in the value we want to deliver. And that lets us focus on our core business. Our core business is not infrastructure. Our core business is not compliance and operations and monitoring. It's to innovate on how can we more effectively enhance our offerings to patients, to improve the communication and cadence that they have with their care team, to enable that idea of aging in place, to realize the potential of the hospital at home, and to continue to build out and enhance our product and service, knowing all the while we've got support from AWS and support from ClearData to deliver that. And it lets us focus on delivering outcomes to our clients. So if you look at what we're trying to bring to market, we're trying to allow patients to interact with their personal devices in a secure way, to be able to communicate back and forth with their care team in a variety of ways depending on the context and situation. In turn, that care team can virtually or from a distance put their eyes on that patient, and there's no substitute for that perspective, whether it's looking at medication, whether it's looking at how wounds are healing, just being able to see in the face how that patient is doing. And it allows the care team to collaborate. We have a number of clients who use our platform within this AWS ClearData environment to communicate with their own specialists to get second opinions real time on a patient they may be interacting with. And everybody gets into the conversation, everybody's got a visual, and they're able to make very in-the-moment care decisions that prevent escalation, unnecessary ER visits, and/or readmissions. And ultimately, our clients can be more efficient in how they deliver care. For a home health agency, historically, there's been a lot of drive time. On average, 30 minutes for a nurse to get out to see a patient, 30 minutes with that patient, and 30 minutes back either to the facility or on to the next patient. Using Synzi's platform and the virtual care, they can probably see 3 patients in that same amount of time. It allows for more frequent but more cost-effective care delivery, ultimately for better outcomes, ultimately to allow that patient, especially in a Medicare elderly population, to stay in-home, which is the best outcome for everybody. So we've been very fortunate in our partnership with ClearData and AWS to benefit from the expertise and services that they bring. And so kind of just to bring to bear how do you protect against those bad metrics and statistics that you saw? How can you take advantage of what Synzi's taken advantage of in terms of products and services? I'm going to hand it back to you, Matt, just to kind of tie up a little bit on what ClearData can provide for folks.
Great. Thank you, Mark. I really appreciate kind of the story and always love focusing on outcomes. It's one of the reasons that I love the Synzi story. I wanted to make sure we spent just a little bit of time on some of the security and compliance risks that I spoke about and Mark also addressed, and what folks actually do about them. And so while this slide, doesn't have a lot of architectures or words around it, I want to really focus on how we can prioritize taking care of your and my patient records beyond just encryption. And oftentimes, if you are talking to an IT professional and they ask you about HIPAA eligibility, or they ask you about how to safeguard your patient records, encryption is certainly the first topic, and it's a big topic. And certainly there are lots of different methods to encrypting data, from at rest, on a disk, in transit, all different kinds of methodologies for identity and access management into the data, who has access, what, where, and how. But the truth is there's a lot more than just encryption out there, and sometimes it's getting back to the basics of IT security principles that can at least set your healthcare organization up for success, or at least, let's say, the best chance of keeping out the bad guys or being notified when a bad guy gets in. Some of those you can see here. Where you really want to start is you want to start with evaluating trends that are actually out there in the security world. Oftentimes, they may be things that you see up here on the screen. So, for example, ransomware, where a healthcare organization may have a compromised database. Let's say you're running some kind of traditional database that stores a lot of the protected health information inside of it, and ransomware actually, is typically sent through some email or similar communication letting you know of the incident. In many cases, you can try to thwart that off, or you can try to certainly get in front of that, as we talked earlier about getting a little bit more proactive. And you do that by running lots of technologies out there, from intrusion detection software, which can, identify when risks are actually coming into your environment, and, of course, ongoing processes. It's not just about technology, though certainly that's what I live in, but oftentimes it's around process. What is your own internal team doing to safeguard your protected health information as part of their change management controls, if you're part of, let's say, a framework like ITIL, as an example? What are you doing at time of security incidents? So when you actually have a malware within your environment identified, what is your team doing to identify that, to mitigate that, to take that off of the network, as an example? So that you can mitigate the blast radius, as you'll often hear. And then finally, when we talk about basics, oftentimes we're talking about, patching medical devices and equipment out in the field can oftentimes be complex. But we also know that, there have shown that a very large percentage of medical devices out there in the field are running older versions of operating systems, in many cases Windows operating systems, no longer able to be patched because they're so out of date. And so it's a massive risk, but an opportunity for healthcare organizations to get in front of these things with some proactive work out there in the field. As we move into the next section, I know that we've got some great questions out there from the audience. As Aaron mentioned, I've had the privilege of working with him for a long time and love to actually hear more around kind of the Synzi story. So Aaron, I'll turn it back to you so that we can,
Thank you so much, Matt and Mark especially. Always great to hear, compelling stories that are truly delivering, outcomes, right, to patients. And I think that's all, what we're here for. So want to start driving through a few of the questions now with the remaining time. So the first one, I think probably is for you, Mark, and, how do agencies change the behavior of their staff who may have relied on, say, text or email to always communicate with their colleagues or other providers, other patients?
Yeah, it's a great question. I think sometimes we're in the change management business as much as anything. So the good news, and I think really kind of what we drive off of, is every nurse who's out there is wanting to deliver good care to their patients. And so sometimes it's really just as simple as highlighting, hey, this is not a HIPAA-compliant way to do things. Now, part of trying to drive change is you have to have value and a positive benefit for that change, right? And so the good news with us is when we come in to roll out the Synzi platform with our clients is we're not just pointing out the problem, we're bringing the solution at the exact same time. So we find that through that training and onboarding process that it really is as simple as some good education, and people are very happy to adopt essentially the same mode of communication. It's just through a different application. They're very comfortable with that, and everybody has a better peace of mind because it's now secure.
Got it. Thanks, Mark. Sort of related and building on top of that, do you have an example of say a Synzi customer who's using methodology that wasn't compliant, and how sort of, by moving on to Synzi, they were able to correct that communication?
Sure. So I think if you look at home health in general, it's been a area that has not had to necessarily adopt a lot of technology. Certainly it's not like the acute care settings where technology has been present in a very heavy way for so long. So I think if you look at a range of our customers, and often it's the smaller regional clients where people have been doing business sort of the same way or delivering care the same way for the past 20, 30 years. And so there's more than one client, and obviously I'm not going to get into too descriptive, but there's been more than one client who has realized that they have some exposure. They're familiar with the penalties, and they've been looking for an effective way to close that gap and solve that problem. And that's been part of how they've gotten engaged with Synzi. I think if you look at some of the historic secure messaging products and offerings out there, they've been good for clinician-to-clinician communications, but there's not been that patient or caregiver aspect. So that's often been a breakdown for the client's methodology that they may have even been aware of but didn't know how to solve. And so I think that's really been maybe one of our best success stories or type of success story, is to be able to go to that home health agency and say, look, we can not only take care of your existing secure clinician-to-clinician messaging, but we can extend that so the clinicians can go back and forth with your patients and their caregivers. So correcting the methodology has actually been fairly straightforward. I think they've just been waiting for the tool to be able to do that.
And I think, empowering and giving patients a secure way to more easily connect with their caregivers is something that's very important. It's something that, I think we're seeing across the industry in general, an emergence of telehealth and other types of initiatives. From your perspective in talking to customers, when would an agency use sort of a HIPAA-compliant, video-based virtual visits versus, actually in-person visits and going, to a patient, say, outside of the hospital? And, what are some of the requirements that organizations should think about, even base things like connectivity, Wi-Fi, etc.?
Sure. So let me kind of start at the connectivity and then kind of move backwards. So the Synzi platform will work across certainly Wi-Fi connections, but also 4G and as low as 3G. And we've intentionally, as we've worked on our product, have worked to optimize even the video virtual visits to run effectively over a 3G connection. And I think, it does effectively. So from a connectivity perspective, really any smart cellular-enabled device or any mobile device that has the ability to get onto a Wi-Fi connection, you're in good shape. And we have a lot of rural customers, too, who are effectively able to use either the internet that's being brought into their home, or there's enough of a cell connection for a 3G data piece, and that works very effectively. So that will, I think, continually, that set of network and broadband and gaps will continually get smaller, and as the carriers continue to enhance their networks. So that's very rarely an issue. I think if we go back and say, well, when does this become effective? We're really looking to complement and enhance what our clients are doing. So we're not trying to replace every in-home visit, and most typically a home health agency will still do an admitting process with the nurse going out to the patient's home for that first visit. And then from there, it's going to depend on the condition as to what the cadence is for further in-home visits versus virtual visits. I will say that very common in our client base is the use of the Synzi platform to monitor and deliver care for patients who have a wound that they're healing from. So they're discharged from the hospital. They may have had most likely a surgical wound, but it could have been an accidental wound. And that's been one of the challenging, I would say one of the most challenging use cases for home health historically, because how can you see how that wound is healing? How can you see how the patient is managing sort of the dressing and changing of bandages, the care of that wound, without actually going out there and seeing it? They've tried historically to have phone conversations, but you can imagine all the sort of source of the ambiguity that can arrive trying to have a verbal conversation. So patients are using the Synzi platform, again, typically with a tablet or their smartphone. They can potentially snap a photo of that wound and send it through a secure message to their nurse to look at. And if there's maybe some questions or the nurse wants to have either another look or to get a specialist to look at it, that's where they'll start to use that video call, so that within the Synzi platform, you can actually bring multiple providers together. So that patient can call their direct nurse, start a video call. They can look just with the camera on that mobile device at the wound, and the nurse can actually bring in real-time a wound specialist, a specialist within their practice into that conversation, so everybody is seeing the same thing. And it's been very effective for everything from helping patients better manage and just the dressing and bandages on their self-treatment of the wound. It's been very good for getting ahead of any potential risks or infections. and being allowed to enabling proactive care to correct a situation rather than that patient ending up in the ER. So there's many other cases, but I think that's one example.
Thanks so much. And I think what you said at one point as part of that answer is something that's really key that we're seeing in the industry is, a lot of what we're trying to do now is not necessarily replace what individuals are doing, but really augment and enhance their ability to deliver care, whether it's like situations you described or using machine learning to improve, how radiologists can triage images. There's such an opportunity that technology has to allow physicians and other caregivers to operate at the top of their license and really deliver meaningful care in ways that they haven't been able to before. I want to close. I know we're at time, and thank again Mark and Matt and everyone who joined today. Really excited about, from AWS standpoint, about our partnerships with ClearData and with Synzi and working together to really, enhance how patients can experience care, not just in the hospital, but anywhere they might be, and really, drive this idea of improving health for every individual out there. So with that, thank you everyone for joining today, and have a wonderful rest of your afternoon and evening.